So we were talking about the vertebral column and we were talking about the different regions, cervical, thoracic, lumbar, and the fact that the cervical has seven vertebrae. And remember, vertebrae are irregular bones. They are numbered from superior to inferior, 1 through 7, and then thoracic 12, they're again numbered 1 through 12, superior to inferior, and lumbar 5, 1 through 5, superior to inferior. And what happens is these are bones that fit into each other. They respond to each other going from the largest of the vertebrae are in the lumbar area, and they definitely become smaller as they get up to the neck, but they tend to change features between the lumbar and the cervical. In the cervical, the actual opening, the vertebral foramen, is largest. The spinal cord is largest in the cervical area than the thoracic or lumbar. And the lumbar, so the low back area, is where there's going to be the added load, and so the bodies of the vertebrae are larger in the lumbar than any other area. And with regard to the thoracic area, you have the ribs coming in and articulating with the thoracic vertebrae in the posterior aspect. So you have extra features. You have the facets where the ribs are going to articulate on the thoracic vertebrae. So what happens is, yes, they relate to one another. I don't really think fitting into each other is the correct way to speak about it. It's they build on each other, but they also have unique features depending on where you are. There are three curves, or actually four curves, sorry. Four curves in the vertebral column. You have the thoracic and sacral curves. So you have a curve in the thoracic and sacral. And those are called primary curves. So if you think of a sweet little baby, a sweet little baby's going to have, sweet little newborn baby's going to have a little bit of a curve in their back area. And then they're going to have a little curve around their tush, around their little butt. And those are primary. You're born with those. And then the other two are the lumbar and cervical curves. So when the little kid starts lifting their head, that cervical curve happens. And when eventually the little kid pushes up and stands up, lumbar curve. The lumbar curves are secondary. Lumbar and cervical curves are secondary curves. And what your book talks about is that they compensate based on organs that are found. I think they also, because a curve is actually stronger than a straight line, they also happen because of this concept of this act of actually standing upright. So four curves: cervical, thoracic, lumbar, sacral. You have the three areas of the vertebral column plus the sacral area and the coccyx. And let's see, what else do we have on here that I need to tell you about? Let's see. Well, there is a way to remember the 7, 12, and 5, and that is you eat your breakfast at 7, your lunch at 12, and your dinner at 5. And so if you remember that, breakfast 7, dinner 12, a breakfast 7, lunch 12, dinner at 5, then not only will you remember how many are in each area, but you'll also remember the areas correctly from superior to inferior. Let's see. Here's a vertebrae, and with the basic parts of the vertebrae. And the basic parts are the body, the arch, and the articular processes. So the body is going to change from each of the different each of the different regions. Go from larger to smaller, from the lumbar to the cervical. And the articular processes are going to shift based on what will actually come around and what will touch this vertebrae. Articular processes are going to be pretty standard on all of them because they actually relate to one another via these articular processes. And so all of these components will be on every one, but you will have some variation based on where you are in the vertebral column. Okay, so let's move on to the next slide. This slide talks about the vertebral discs. These discs are made up of fibrocartilage, and what happens is they are used as shock absorbers, and they're actually really good about it as long as they're still there. And unfortunately, what happens is as we age, the space between the vertebrae become less pronounced. This fibrocartilage is less hydrated, so there's less fluid because fibrocartilage has fibers. You have collagen fibers in what's known as a ring shape, and then you have fluid in that ground substance. And as we age, unfortunately, the fibers become less strong. That's true of all your fibers, and the ground substance has less water in it. So the space between the vertebrae become reduced, and that's bad enough because you do have pain receptors on the ends of the bodies, but you also have spinal nerves coming out. So the vertebral column houses the spinal cord, and then exiting off the spinal cord are these spinal nerves. And the problem with that condensing, or that lack of space, or the vertebral discs becoming losing their height, is that those nerves then can be compromised, and that is extremely painful. On this, speaking on a more positive note, on this image, you can see those articulating surfaces. It's called a superior articulating facet. And then at the bottom of this image, you have an inferior articulating process, which is also if it were pointing to the facet part. And what there is on those is a little bit, at the top it's almost being cut off. There's a little cartilage, and that's how those vertebrae make a joint with each other. And they make a joint with each other via these discs, but also via the facets. And it's the facets that allow us the very subtle movement that the back gives us. So we don't have movement in all directions with regard to our back, but we do have very I guess minute movements that you can make with the back. So the back can do multiple different, actually just get in multiple different positions because of these facets between. And then this picture shows you the actual regions. You do have all of the regions in your book. You have all of the vertebrae shown to you individually. I didn't put them all in this particular teaching time because I think looking at them is probably much better than me verbalizing, overly verbalizing about them. But there are a couple of things I wanted to say, at least in this particular portion. This is the neck portion, the cervical portion, and you see that numbering from 1 to 7. You have C1 has another name, it's called atlas. C2 has another name, and it's called axis. And Atlas is the one that's holding up your head, just like Atlas the god holds up the earth, I guess, or holds up the universe, the Greek god, or he may be Roman, one or the other. And then Atlas sits atop dens. So Atlas is actually kind of like a ring, and it sits atop C2, which is axis, and it's kind of like that ring and peg game. And that allows you to actually have this movement of saying no with regard to your head. So that arrangement between C1 and C2 allows a specific movement with the help of the muscles, of course, specific movement that allows you to turn your head, basically not only to say no, but to turn your head and to see if look in your blind spot in your driving. Then also in C7 you have this vertebral prominence, which it's actually the largest spinous process, and you do see this on people whose vertebral column is closer to the surface for whatever reason. You can see this. It actually can be felt. You could put your finger. You could put your finger in your back about where your neck is joining your shoulders, and you can feel this vertebral prominence. This, I guess I gave it away a little bit early. This is atlas and axis. This is where atlas, the ring, is sitting on top of the little thumb-like dens of axis, with, of course, ligaments holding it in. And then you see the facets. This is the blue part of the facets that occiput's going to sit on, and this is going to allow that movement to look over your shoulder. The thoracic area, the thoracic area is interesting because, again, this is where the ribs come in. So thoracic area is T1 to 12. They have heart-shaped bodies. Isn't that cute, since that's the area where you have your heart and your lungs? Larger than C1, or larger than the cervical, but not as big as larger bodies, but not as big as a big foramen. And then you do have these costal facets that articulate with the heads of the ribs. Speaking of the ribs, you have 12, and what happens is all 12 articulate in the posterior aspect, but you do have some shifting with regard to the shapes of the thoracic vertebrae to respond to what's going to come below, meaning the lumbars. So 10 to 12 transition to the lumbar, and then 9 to 11 articulate with one pair of ribs, and then 1 through 8 articulate with 2, and the ribs at T1 to T10 contact costal cartilage and transverse costal facets. Again, probably something I have a picture coming up, maybe to talk about that when we see the picture of the rib cage a little bit clearer, I guess. These are the lumbars, and they're bigger, oval shaped. The discs are bigger in the lumbar area also, because there's more need for shock absorption. And the spinous processes are much shorter, heavier, denser bone, because of the big muscles of the back being attached. And then this one, I thought this one was pretty nice. I usually don't put these kinds of things on your lecture, but you can see the comparison of the bodies, and this is an average body. So the first one is going to be C1, then you have a thoracic in the middle, and then you have a lumbar. So I guess that's what they consider heart shape for the thoracic. Lumbar, certainly broader, heavier in the whole makeup of the vertebrae. And then you can also see how that that opening areas where the spinal cord comes through, much larger in the cervical area, and then still pretty large in the thoracic, and then lumbar not so much. The spinal cord actually ends about L1, sometimes T12, L1, L1, L2, something like that. So what you have coming through most of these lumbars are the cauda equina. And we will pick this up on the next one.